Hello. I'd like to talk to you a bit about one of the big topics of the day, namely long COVID infection. So COVID-19 virus, everyone is familiar with it. Many of us have already had it and recovered from it. But unfortunately, there are people who never seem to regain normal vitality and function after this infection. Now, it's a very complex set of matters. However, it is clear scientifically that people who don't recover have underlying conditions that predispose them to immune system dysfunction. Now, whether it's chronic inflammation from a viral infection, another autoimmune disorder, the conditions can be many, mold toxicity, all of these things can negatively affect the function of your immune system. But one factor stands out, and it's this. The COVID virus causes inflammation in your body, and that spike protein is the core of the issue. And when we have patients who have infection and don't recover in a timely manner and end up with symptoms of chronic fatigue and even perhaps fibromyalgia, not to mention other lung dysfunction issues, we have to look at Epstein-Barr virus infection. And when we look, we will find it. And as a result, there are many treatments that we can offer patients to eradicate chronic underlying infections, as well as to enhance their lung function and the overall function of their immune system. So our approach is to find out what underlying conditions may predispose a patient to that inability to, shake off the virus, treat those things, and then also add extra treatment for rehabilitating the macrophages, the components of the immune system that can fight inflammation very directly. And macrophages have two different states. One is inflammatory, one is pro-inflammatory. And in this condition of these chronic viral infections, whether it's COVID, Epstein-Barr, or herpes, any of these things, the macrophages will get turned on and stay in the inflammatory state constantly, not resting. And this depletes the resources of the immune system and can predispose a patient to further immune system instability and dysfunction. So as a result, we find it's very, very important to look at all of these underlying factors to get an optimal result to help people come back from this potentially devastating problem. Thank you.